lumbar pain or low back pain is the #1 thing physical therapists see. So the question is, why do low backs hurt so much? And there's a lot of reasons for it. So I'm going to go over some of the basics here. First, let's talk about some of the anatomy. So the curvature of the spine here is lordosis. So it kind of curves this way, which sets up some certain things here, which I'll get into in a bit. The spine has 6 motions. So it does flexion or bending forward, extension, leaning back, side bending to the left, side bending to the right, rotation to the left, and rotation to the right. Now, this part of the spine has got these facet joints. Well, the whole spine's got facet joints, and these ones are kind of on top of each other like this. If you look at the difference here, these ones kind of slide on top of each other like that. These ones are much more vertical. So what that does, it kind of limits how much rotation and side bending you get. You get some, but just because of that shape, it's going to block some of that. Now, there are capsules around all these facet joints, which are kind of like little sacks of leather, and they can become stiff. So if they stiffen up and you already have kind of a stiffer structure, it's going to severely limit rotation. So it kind of leaves you with some flexion, so bending forward, or extension. Now flexion, that can irritate a herniated disc. So this right here, this little red thing, that's meant to be a herniated disc. And just the way fluid mechanics work, as you bend forward, the fluid can push backwards onto these nerves. Now, a couple decades ago, there was a lot of research done on the discs. So what that did was create almost this paranoia, this fear of flexion. Herniated discs don't happen that often. And so we have a whole bunch of therapists now and practitioners that basically told people don't load your spine into a flexion. And what that did was create fear amongst people and practitioners around deadlifting. One of the things that holds the spine together is these muscles called your paraspinals. They attach vertebrae to vertebrae. So if you are afraid of flexing, never picking things up off the ground, these muscles start to get weak over time. And that's what we see in some studies. You see a lot of MRI studies that show fatty infiltrates in this musculature here. Now, fatty infiltrates is just a way of saying muscle atrophy. So we know that a weaker low back will turn into low back pain. So, where people will say deadlifting is bad for your back, I say your back is bad because you don't deadlift. You gotta get these muscles stronger. Now, the other direction that a lot of people tend to develop sensitivity to is extension or leaning back. You can imagine if these are the vertebrae, as you lean back, the facet joints kind of rub together. Now, when you're young and perfect, there's cartilage in there, and that shouldn't be an issue. But as you age and some arthritis sets in, that's where some of the arthritis will start to occur, right between these facet joints. So if you rub 2 bones against each other, they can get a little irritated. So what do we do in that situation? What if you have a back that's sensitive to extension? There's a couple things that can kind of make it worse. One is having a belly. If you have a big belly, just because of gravity and the curvature of the spine, it's going to naturally pull the spine into more extension. The other one is your hip flexors. So if you have to sit for work, your body will sort of adapt to that position over time, and then your hip flexors, namely your psoas major and minor, which attach to the sides of vertebrae and attach to the femur. So you can picture something like this. If that is taut already, and when you go to stand, it pulls all tension out of that hip flexor and can drive those vertebrae forward into more extension. So what do? Lose the belly, right? Number 1. Number 2, we try to mobilize the hip flexor, gain some extensibility. And number 3, strengthen the muscles in the back. That's probably the most important part, is get the back nice and strong so it can tolerate some load.